KCBS, in partnership with UCSF Health, presents As Prescribed, a weekly conversation with leading medical experts from UCSF Medical Center and UCSF Benioff Children's Hospitals.
Hello and welcome to As Prescribed. I'm Kathy Novak. People with degenerative conditions such as arthritis may have heard of options known as biologic treatments, possibly involving stem cell therapies. There is a lot of information online and it could be difficult to find out what is right for you. So the UCSF Regenerative Orthopedics program is trying to cut through that. Joining us today to discuss this is Dr. Brian Feeley. He is Chief of Sports Medicine and Shoulder Service and Professor in Residence at UCSF. Dr. Feeley, thanks very much for joining us.
Thank you for having me. It's a pleasure.
So tell us, how do these treatments actually work?
So that's a great question. I think one of the hardest parts, first of all, is defining what these treatments are. And in general, they tend to boil down into two categories. The first and the more common and much older is platelet-rich plasma, or PRP. PRP works probably by decreasing inflammation within joints or within tissues. And some of the evidence suggests that it may actually be beneficial for some conditions, especially early arthritis. The bigger and more complicated question is, what are stem cell treatments? Are they really stem cells? And what do they actually work for? And that's kind of what this program is designed to do, is to look at these treatments and see what patients are being prescribed, what the benefits are, and when we should avoid these treatments due to either cost or safety profiles.
So if someone comes to your program, if I stick with that arthritis example, how does that work then? What would the treatment options be for that person?
Yeah, I think first of all, for most people with arthritis, initially, this would be a telemedicine consultation. So you get to ask questions. We're not actually prescribing any biologics or regenerative treatments within that consultation, because that takes some of the bias out. So myself or my colleagues that would do the consultation aren't going to have any profit or benefit from doing it other than providing information. For somebody with arthritis, I think we would go through what typically is done, which is physical therapy, activity modification, the real benefits for diet and weight loss and how that benefits. But then we would talk about whether or not for that particular patient, something like a platelet-rich plasma injection or some of the clinical trials involved in stem cells would be beneficial. And in particular, some of the evidence does show that if you have early arthritis, for the knee in particular, you may benefit from having a PRP injection, but currently there's very little evidence that you would benefit from having a stem cell injection.
So when you talk about people coming to you because you're trying to take out that bias, I guess you're suggesting there that others may be biased. What is the issue of people going directly to people who might be selling a stem cell therapy?
Yeah, I think it's hard because we're often our own referral sources. So for a surgeon, I tend to refer patients to myself. If I say you have an ACL tear, you need surgery, I benefit from that. So it's a little bit of a conflict of interest. The hard part with these regenerative centers is that the people that are recommending it for patients without necessarily giving the best data and the best information. And unlike most medical procedures in the United States, this isn't covered by insurance, and the costs of these are prohibitive. So for instance, a PRP injection may be anywhere from $500 to $1,500. Some of the stem cell therapies that are offered are anywhere between $15,000 to $50,000. And if you're pinning your hopes on your arthritis being cured with a stem cell injection and willing to essentially give up a large chunk of your life savings, I don't think that's probably the best option for most patients.
Yeah, sure. And then apart from the cost, if you're looking at these options, can you take us through a little bit about what the advantages and disadvantages might be?
So the advantages for PRP, which is essentially what would happen is you go into a clinic, you get a blood draw similar to if you were donating blood, but a significantly smaller amount. that would then be concentrated. So your blood is spun down. So the platelet part of it is removed. That would be then injected either into the knee, into the hip, around a tendon that is injured. And this is not new. This was actually started in the 1970s and early 80s with dentists trying to rebuild cavities in the mouth. It's been used by veterinarians, and then it was used for tennis players and other athletes for tendinopathies or tendon injuries. The most important part about PRP is it's safe. Every single study shows that it is a safe product to use. So I tell patients, if nothing else, a PRP product is going to be safe for you, and it may be effective. And that's what this program is designed to do, is to figure out who it's going to be most effective for. Stem cell therapies are very different, and they're all grouped into one kind of regenerative bucket, but the reality is a lot of the times what you're getting aren't even stem cells. Stem cells are a very specific definition. They need to be capable of renewing themselves and differentiate or become something else along specific lineages. Within that, I usually counsel patients that unless you're absolutely sure what you're getting, we don't have the studies right now to say essentially this is going to be either safe or effective for you. So I really try to counsel patients to use this as sparingly as possible.
And if not only potentially ineffective, there could be some serious health risks as well, I presume?
Yeah, the reality is that the health risks are few and far between, but when they have happened, they've been often disastrous. So one of the biggest complications is that you can get an infection. And there are case reports of batches of stem cells that have given people spinal infections, blindness, inability to walk. And these are disastrous consequences for somebody that is going in for something that is supposed to be regenerative. And really, these are essentially should be never events, but we do see them from time to time.
And you are treating patients via telemedicine, right? So you may not even be referring them within UCSF or even within the Bay Area.
Yeah, I mean, one of the few benefits of COVID is we have learned how to use telemedicine effectively. So we're able to reach people across the country. We often will refer patients within the system, within UCSF or within our other UC campuses. A majority of patients, we can just give the information and say, you're welcome to seek somebody out in your area with this additional amount of information. So again, that helps take our bias out and give information to patients without having to feel like there's some sort of gain for ourselves.
And that means too, then I presume that you could be talking to people all around the country as well and in giving that advice.
Yeah, absolutely. We've talked to everybody from Maine to Hawaii at this point.
Oh, that's great. Dr. Brian Feeley, thanks so much for taking us through that.
Thank you. It was a pleasure to be here, Kathy.
Dr. Brian Feeley is Chief of Sports Medicine and Shoulder Service and Professor in Residence at UCSF. And I'm Kathy Novak. Thanks so much for tuning in to As Prescribed.
As Prescribed, every Thursday at 1:30, right here on the Bay Area's news station, All News 106.9 at AM 740 KCBS, and streaming on the Odyssey app. The proceeding was sponsored by UCSF.